Let's talk about the state of women's health. This report was put together by the researchers at Accenture and Springboard. One of the first points that the authors make, which I completely agree with, is that we need to redefine women's health. Now, when I say women's health, most people naturally think of reproductive health. So do most politicians. This is really only a very tiny part of what makes a woman healthy. The health of a woman is dependent on so much more than her reproductive health. It includes all of these circles here. The authors also pointed out historically where the health of women has gained some traction through grassroots movements, government initiatives, and global conventions. Pause to read. But spoiler alert, it's not nearly enough. Women's health is dramatically underfunded compared to men's health. For example, the Federal Office for Research on Women's Health's budget only increased 9% between 2003 of $41 million to 2020 of $45 million. In 2023, the National Institutes of Health budget was $43 billion, of which menopause, a huge factor in women's health, only received $15 million, 0.03%. Female-specific conditions outside of oncology lag men's by 99% in global investment. Only 5% of the medications approved by the FDA in 2022 were for female-specific conditions. The National Institutes of Health for female-dominant diseases are underfunded by 64% compared to 8% for male-dominated diseases. What happens from all of this? A female currently can expect to live 20 to 25% of her life in poorer health than her male counterparts, and most of that time is spent in menopause. And in the area of digital health, women's health funding lags by about 96%. When women are included in studies, only about half of the time is the data reported, male versus female outcomes. This to me is staggering. In the United States, cardiovascular disease is the leading cause of death for women, yet women make up only approximately 1/3 of the clinical trial subjects. Shockingly, of the FDA-approved drugs on the market, where female data was included, showed significantly higher adverse drug reactions in women. A very famous reversal. It took 21 years after Ambien was approved to recommend lower dosage in women due to cognitive deficits. Between 2013 to 2024, women's health funding saw a 9% decrease over time. What happens when women's health is understudied, undervalued, and misunderstood? You're going to wait longer for a diagnosis. You're going to have poorer outcomes versus your male counterparts. The medications aren't going to work for you as well. You're more likely to be labeled hysterical or emotional. Pause to read. And even though 400,000 women in the U.S. are transitioning to menopause each year, very few are actually diagnosed or have a delayed diagnosis. Women have significantly higher healthcare spending in their 20s, 30s, and 40s, and often delay or don't even go to the clinician because of cost. I want to acknowledge the authors of this incredible report and who sponsored it, and leave you with a call to action. We need to put pressure on the boards that accreditate our clinical training programs, like medical schools, to include a robust women's health curriculum to include menopause. We probably need legislation to make this happen. Although reproductive rights are very important, it is also important to include all aspects of women's health in the conversation.